Hi, guys. It is Dr. Shelley, and it is Friday, October 16th. Welcome to yet another episode of uh, my Facebook Live Coping with COVID. So, I hope you guys have had a wonderful week so far and enjoying the fall weather, depending on where you live. I am, to refresh anyone's memory, a board certified obstetrician gynecologist, but I practice only gynecology at this point and anti aging and minimally invasive surgeries. My office is located in Central Florida, so we are not quite into the cool temperatures yet here, even though we are seeing a little bit off of our regular scorching temperatures. So we've seen a little bit of cooling, comparatively speaking, but still just as humid as always in Central Florida thus far. Uh, and every week, since the beginning of COVID, we've been coming together and just kind of updating what's been going on with COVID over the week, as well as addressing any concerns and really, like I have said before, focusing on how to live with COVID, because this is something that we're probably going to have that is affecting our lives for at least probably 2 years. Sooner if we're lucky, but COVID's going to be part of our life, and it is the new norm. So not just trying to wait this out, but actually moving forward with our lives and learning how to cope with COVID. So today is October 16th. Let's go over our statistics first, and then we will delve into our COVID updates for the week. And then it is October. We tend to forget that. And I always call it COVID time. We tend to get stuck in COVID time, and everything becomes a big blur. But this is October. We are in fall, and as we discussed last week, we need to embrace the things that we can embrace and enjoy, and still not forget about COVID, because of course we can't, but also not forget that there is a world out there, there is a life that we did leave before COVID, and that we need to try to start incorporating back in. So let's go over the statistics first. This week we have gotten to worldwide, our cases are almost at 40 million. Really scary. 39.5 million worldwide cases, and we are over 1 million. We're at 1.1 million deaths from COVID. I mean, million people. We're not talking thousands anymore. We're in the million range across the world with COVID deaths. So it's very, very alarming. Now, we do have 29 million survivors, so that is, of course, a blessing. But that means that we've lost a significant amount of people. And as we always discuss, these are people. These aren't just numbers. You hear these numbers over and over again and kind of get a little dull to it. But this is serious. This could be your loved one. This could be a friend of yours that you haven't seen. And I hate that it has to hit home for a lot of people before they really understand that this is serious. In the United States, we're at 8.2 million cases. 8.2. And there are 223,000 deaths and 5.3 million survivors. So once again, we do applaud our survivors, and we are happy about that. In Florida, I always give the local data because I am located in Central Florida. Within Florida, we have 748,000 cases, 16,000 deaths, and 480,000 survivors. We also have 46.9 thousand that have been hospitalized throughout the pandemic. More local data within Florida. The average age is 40 to 43 statewide. My office is located in Lake County, which is a suburb of Orange County or Orlando. And within Lake County, our numbers are at 8,000. A month ago, we were at 7.2 thousand, so that means we have over 800 new cases in the last month. And Lake County is a small county. We have 682 that have been hospitalized throughout this whole pandemic in Lake County, and then 268 deaths. Now, just so you know, when you look at statistics here in Florida, a lot of times they like to divide them up between Florida residents and non-residents. That's because we have a lot of tourists that come to Florida, but we also have a lot of what we call snowbirds. And so my feeling is this: if you were in Florida and you died in Florida, the likelihood is you weren't just visiting for a day or two. It's possible, but I would assume we're talking about people that are probably more like our snowbirds. So I'm counting those numbers. I'm not separating out our non-residents from our residents. I think that is actually a little bit of a false reading. As a physician here, we have lots of people that do call Florida their second home and have a second home here and spend a significant part of the year here. So whether or not they're official Florida resident or not, we do accept them as Floridians, and their death is just as important as someone that actually has a Florida license. So having said that, there were 268 deaths in Lake County, and that's up almost 100 deaths in a month. So people just need to realize that, actually in 3 weeks. So we're talking about 99 more people died in Lake County in the last 3 weeks compared. So just to put things in perspective. The range, our range is along with the states. That median range is about age 43, and our women or men are fairly equal. The range as far as ages goes anywhere from 15 all the way up to 44 is the big range, which is pretty interesting because Lake County actually has an older population. So we're very lucky that our elderly population is staying home and is staying safe because, of course, we know the disease is more devastating in that age group. Orange County, which is our bigger sister county, is at 42.6 thousand cases. That's up from 3 weeks ago of 38.2, and 1.5 thousand hospitalizations, and unfortunately 1.1 thousand deaths. So over 1,000 people have died within Orange County from COVID. The percentage rate of positive testing of note in Lake County is, as of yesterday, so it varies every day, but as of yesterday was down as low as 2.6%. So that's exciting news for Lake County. And Orange County runs more along the state lines, which was at 4.9% yesterday. Florida, we had 3,356 new cases yesterday. That's up from 3 weeks ago, but down from when we were exploding back in August when we had twice as many cases. However, the numbers are trending up, just so we are clear. And what happened 2 weeks ago, as we discussed previously, we went to full reopen. So we are seeing our numbers starting to tick back up again with that full reopen. So not anything outrageously dramatic as of yet, but we do need to keep an eye on that. And this is what we anticipated, is that the numbers we would start seeing the effects of the full reopen about 2 weeks later, and that's what we're seeing. And unfortunately, if the history repeats itself, we will also start to see the number of deaths start to increase in the next 2 weeks after this. First, we see the cases spike, then we start to see the death rate go up. Luckily, in other states where they are seeing significant rises in their numbers, the death rate is not rising at the same number as the same percentage as the number of cases. Luckily, because of all the new treatments that we have that have significantly helped we physicians to decrease the deaths from COVID. The overall rate of positivity with testing is at 4.4%. That is up from a month ago when it was 4.1%. And the average overall, the whole time frame, really has not budged. So even though our numbers are lower for a particular day, when you look at it cumulatively, our percentage positive throughout the whole pandemic has maintained at about 13.2%. The spectrum in Orange County and has been more in the younger age groups. And so we're seeing about a 15 to the age groups in Florida period, more common in the 15 to 34 range group. And then luckily, once again, our elderly population, the numbers are not as high, which is a blessing. The other states that are affected, so first of all, worldwide, the numbers are just go up, but the countries are still staying the same. The United States is hands and feet, unfortunately, above all the other countries, with our 8.2 million cases, and above with our deaths as well. But behind that comes India, then Brazil, then Russia. Now, what's interesting is that even though India has over 2 million more cases of COVID than Brazil, Brazil has more deaths. So, of course, that is of concern, and it once again goes to access to medical care and to the ability to have access to intensive care if needed, and the drugs that we have shown are helpful in preventing COVID death. So that kind of goes through all our numbers. The other thing is within Central Florida, the numbers in the hospitals are still, we still have good bed availability here in Central Florida. Even though the numbers have gone up a little bit over the last couple of weeks, we've been kind of going a little bit on into an uptick. We had been down as low as 80 patients in-house. Now we're at 93 at Orlando Regional, which is one of the main hospitals here. Hi, Karen. The other the ICU holding about steady. We have 12 in the ICU with Orlando Regional versus 11, and 5 on that are requiring ventilation. So the numbers are down as far as that's concerned. Now the percentage of positive patients, so patients that have been tested while they're in the hospital for COVID-like symptoms, or just to be tested because they're there for other reasons and they want to make sure that, whether these patients have COVID or not, is up to 8.6%, and that's up. We had gotten as low as 4.6% within the hospital, so a little concerning as far as that's concerned. So that kind of gives us all our data, like the hard numbers. And, I like to just kind of get that out of the way so that people are kind of aware of that. So what else is there? So what's been going on this week? Obviously, last week was all with the president testing positive and all of the treatments that went along with that. This week, there was a rally that was held here in Sanford, which is right above Orlando. There was a lot of attendance there. There was a lot of non-mask usage. And there is definitely some concern about what the repercussions of that will be. We shall see once again in a couple of weeks as far as that's concerned with the rallies being there. Good morning, Kanisha. Or good afternoon, excuse me. So we will see what the results of that is. We are in full reopen here in Florida. Most of the stuff hasn't really changed. I've been out. And most of the restaurants are still maintaining their distance and trying to keep people distance. People are still wearing masks within most establishments. Are still enforcing that. So I haven't seen that much of a change outwardly. Now, what our governor just decreed 2 days ago is that the virtual meetings for government agencies is to resume in person now. And so there is some concern with that, of course, due to exposure. Also, there was some positives, of course, that went along with COVID. And one of them was when we were talking about things like government meetings and stuff, people that might have had to, in the past, take off work in order to be able to go and be able to speak their piece or to listen in on the proceedings, were able to very simply sit in front of their computer and hop on Zoom or what have you and observe these proceedings. And so most organizations found that there was significantly more participation with the advent of virtual meetings. So there is some concern with not only just transmission, but a decrease in the community's ability to participate by taking things from virtual and putting them back into person meetings. What I've seen overall is that most of the agencies are doing a hybrid where they will have in person, but still try to televise it as well. But you will not be able to express any concerns or make any comments live during that if you're not present there. And then they're going to be looking at safety measures, of course, for those that do come in person. So that's kind of where we are in Florida. Orlando, Orange County Public School System. I get their updates all the time because that's where we live, and my daughter is a high school student in the Orange County Public School System. So they have over 400 cases within the Orange County public school system since the beginning of the pandemic. And the schools are functioning based on a day-to-day basis. When they're testing, if they have a positive child, then they do the contact tracing, and that child and all the contacts are quarantined out. But the schools have not had to close. We haven't had any recent school closures due to outbreaks at this point, and we're hoping that that continues to stay that way. So what's new otherwise? There's some studies out that are showing that now the trend seems to be that we Americans are aware that there is COVID out there, and that it is contagious, and are practicing safe parameters when we are around strangers and outside, but we still are getting, or actually even more so, getting more lax with smaller gatherings, and that's where they think that this is spreading, is in the small gathering setting. And we're having these little what do they call them? Hotspots. I'm forgetting the name that they use off the top of my head. But anyway, so like something like they had a Sweet 16 party, and they got 40 cases from just that one small Sweet 16 party, or a family that got together for a reunion, and I think actually all of them contracted COVID. I think maybe one person out of that whole group did not contract COVID, and a couple of them died secondary to that. So please remember that just because you know the person doesn't mean that they don't have COVID, and that the disease is contagious before people have symptoms. So it's not like they have a bar on their head that says that they have COVID. But that's a big concern as people are going inside, and we're getting closer to the holidays, and people are going to be around family members, that your family members may not be safe. Do not assume that they are, unfortunately. And nothing to say anything bad about your family members. There was also a study that had been kind of the data. Remember, with data, things can be twisted with different ways to suit who wishes them to suit. But there was a study about mask wearing, and it was interpreted by the higher ups that 85% of people that wore masks were still getting COVID. And that's not what that study was actually saying. The study was saying that of the people that were interviewed that had COVID, that the majority of them, 85% of them, were either wearing masks all the time or some of the time, except when they were around small gatherings of people that they knew. So it was that they were wearing their mask most of the time. But once again, it doesn't matter. It's just like when you're having sex, right? If you can wear a condom 98% of the time, but that 2% can still get you pregnant. So you don't get brownie points necessarily for doing it most of the time. You really need to be practicing it all, because it's that one person that has COVID when you're not wearing the mask, or you that has COVID and you're spreading it to other people and not knowing. So once again, you also do not know that you are contagious unless you actually become symptomatic, but you have then been shedding the disease before that for several days. So just keep that in fact and understand what that study did show, okay? So that if you hear somebody say that you shouldn't wear masks because 85% of the people that were wearing masks got COVID, that is not what that study showed. So they need to go back and reassess that. The numbers are going up in within the United States. Our Midwest is just getting hammered, and the smaller states. So Wyoming's numbers are record. We're seeing. North Carolina is now the eighth highest number. They've had a couple of deaths of their teachers. And the rural areas, it's really dangerous when they get hit because they don't have the hospital capacity that a bigger city will have. So some of these smaller rural areas in the Midwest, they're very concerned because their death rates are going to be really going high because they can't get their people to the care that they need. So that's definitely of concern, and that's what we once again talk about, the flattening the curve. So the curve is not flattened in several of the Midwest states, and there's a big concern, especially as it gets colder and people go inside, that we're going to have it's super spreaders. That's what I was trying to remember, a super spreader event, and we don't want those. But that we don't want the healthcare systems to be overwhelmed in these towns. They're actually literally trying to take people out by helicopters and by what they call med evacuation units and by ambulance to get these people from these rural areas to cities where they can get care. So that is definitely a big concern. As far as our and then within worldwide, many European countries are seeing spikes now. Even countries that had done really, really well in the beginning are seeing their numbers increase exponentially. So we're seeing big crackdowns in the UK, Spain, France, Italy, where they're seeing there's numbers, and China's once again starting to see an uptake. So all just tons of countries over there are seeing issues with what they're calling the second wave, because most of them actually did quiet down. Whereas the United States, of course, we don't have a second wave because we never got rid of our first. We're still on the first wave that just keeps going and going and going. So but now we're not alone. In the fact that now everybody seems to be battling the disease, even though we still far surpass any other country. And I saw a statistic that said between the United States, India, and Brazil, we make up more than 1/4 of the deaths worldwide, period. Period. Not just for coronavirus, just period. So of the people that have died since March. So that's really concerning, and definitely something that we should not be proud of. And we call ourselves, one of, we think of ourselves as a leading country, but our example has not been the best by any way, shape, or form. Vaccinations, the CD experts are saying that there is not going to be a vaccine by November 1st. So for anyone that's worried about that, it's not coming. If we're lucky, they may start vaccinations as soon as maybe December 1st or the end of the year. They will not have significant amount of vaccinations for anybody until the spring, because they would have to ramp the numbers up. And I know that there are about 35% of people that say that if there's an early vaccine, they may not take it. All I just tell you is to keep an open mind. Let's see what comes down the pipeline. And all vaccinations are not bad, and we have seen significant improvement with many diseases from vaccines. So, let them do their studies. The drug companies have agreed that they will not release a vaccine based on any kind of pressure from any kind of political venues. That when the vaccine gets released, it will be because it is safe and efficacious for people to use. The states are getting geared up to be able to give vaccinations, and CVS and Walgreens are going to be coordinated in this vaccination giving. They're going to actually, some of the long-term facilities and nursing homes will have someone set up as there to actually give vaccines. So they will be targeting the most vulnerable people first. So that is really good, and then start panning that out. As far as herd immunity, you hear that term being used. People have to realize that, first of all, herd immunity is different for every single disease. And the coronavirus is resembling more the flu, meaning they're different strains that are occurring. So the likelihood is that we would have to have potentially anywhere from 60% on the good end, but more like 80 to 90% of all Americans to get COVID before we could actually consider ourselves having herd immunity. And then, even then, it's just for that particular strain, and there'll be a new strain that comes right behind it potentially, or mutates. So that is not acceptable, because that would also go with millions of people dying. And that, once again, should not be acceptable to anyone. Nobody's life is dispensable. There was a study there are a couple of studies that are out that just came with some positive news. So I think we kind of talked about it a little bit on an earlier show about the blood type O, and whether or not that was showing some positive effects as far as decreasing the ability to get COVID and or die of it. So there's two more studies that just came out on the blood type O, and it definitely does seem that people with blood type O have less severe cases of COVID and may be less likely to get it. So definitely, if your blood type is O, that's a big positive for you. It does not mean that you cannot get coronavirus. So please do not extrapolate it the other way and think that that is what I'm telling you, because I'm not telling you that. And it also does not mean that if you have A type, which they're saying is not as favorable, that you're going to die of coronavirus. That does not mean that. Just means that people with O type tend to have more favorable outcomes. And so it's a blessing for them. And what we're going to do is use that data to try to understand why people with O type seem to do better with COVID-19, so that we can then use it for people that don't have O type. So that's what we do, is we take that as a positive, not as a negative, and try to figure out what's going on there. What do they have that we don't have? And because I'm not an O type, unfortunately, and then use that to make things better for everyone, right? And just so you know, within the United States, O type is 45% of Americans are O, and 40% are A, and then the rest are A, B people. So that's good information to know. Other things out there, you may have heard that the WHO just completed a study and said that remdesivir, which has been one of the things that has been utilized in most of the protocols here in the United States for hospitalized patients to decrease the severity of the disease, has been found in this particular study to not decrease mortality with COVID-19, and not significantly decrease the severity of the symptoms. We, of course, are giving cocktails, so we don't know. We're not just giving people remdesivir, we're giving people multiple things. And of course, the president did receive remdesivir as well. I don't think that any of the protocols have changed based on this information. We'll see. This just came out. So stay tuned on that. I think that that's still, until proven otherwise, one of the therapies that at least did show some improvement. And this study that just came out from the WHO has not been completely vetted out. It's a preliminary thing. So stay tuned. Let's see how that goes. Now, what is of interest is there are two other drugs. One that is very similar to remdesivir, called I'm going to mess it up. Favipiravir. Yeah, you say that 5 times fast. So that one is, the neat thing is that remdesivir is IV, and there's a limited supply, at least in the United States, and so it requires being, it's given to patients that are hospitalized. This new drug is actually a spray, can be administered outpatient, and is geared to catching people early in the disease to decrease the severity of the disease. So that's really exciting. And that one is geared at stopping the coronavirus, once it invades the cells, from replicating, from duplicating, and becoming lots of mini coronaviruses that spread throughout the body. So that one is a really good one. We're looking forward to more data on that, and hopefully some ability to start treating people with that. And the other one is called, I'm going to mess that one up too, but it's called Camostat mesylate, I believe. It is actually a drug that's been used for years for pancreatitis, which is a disease of the pancreas. It's oral. It's been overall has a very good safety profile. And that one stops the virus. The virus, you've seen the little spike proteins that you see when you look at the coronavirus. And so it stops the spike protein from being able to invade the cell. And so that is one, once again, that they're believing, if it's given early on, could significantly decrease the severity of COVID. So as I always tell people, we don't want you to get COVID, but we certainly don't want you to die of COVID. And we don't want you to end up hospitalized or have some of the severe symptoms that go with it. So anything that we can use early on to help to treat the disease if someone gets it and make their course as mild as possible is definitely the way to go until we have a vaccine. And even when we get a vaccine, since the majority of people are, not the majority, excuse me, but a significant amount of people, at least at this point, are not feeling warm and fuzzy about getting it, the vaccine is not going to be a cure. It will be something that helps us, but we still need medications that we can utilize to fight the coronavirus. So really excited about that data. So I wanted to talk to you guys, though, once again, let's move just for a little bit off of coronavirus, and let's talk about fall things. And so we are in October. I know it's hard to believe. We are actually in October, or month 5 of COVID, if we want to look at it. No, actually oh God. We're in month 7 of COVID. Oh, that's scary. So we do get caught up in COVID time, I call it, but this is Breast Cancer Awareness Month. And I think we should really be aware, because we forget. We get so caught up in COVID that we forget what we normally are doing at this time of year. So this is a very important time of year because, yes, women have breast cancer all times of the year, but this is a time when people are reminded of the severity of it, and so we do not want to forget this, because breast cancer is the number one cancer in women besides skin cancer. A lot of people don't realize that skin cancer is number 1. So let's go over a little bit of statistics on breast cancer, and we'll talk about it a little bit, and then we can, if you would like, we can delve into it a little bit more in detail next week. I will leave that up to you guys if you would like. So in 2020, just so you know, they're going to estimate 276,000 new cases of invasive breast cancer, because there's something called superficial or carcinoma in situ, meaning like the cancer's knocking at the door, but it hasn't actually invaded the breast itself. So 276,000 new cases of invasive breast cancer will be diagnosed in this year in the United States, okay? And then another 49,000 cases of what I just told you, the carcinoma in situ. 64%, luckily, of breast cancers are diagnosed when they are local. They have not spread out of the breast. That's important, because those can be much more easily treated than if they have spread, or another word is metastasized. So we do not want that to occur, of course. So if it's within the breast, we have usually a 99% success rate. Now, cancers are all different. Some are more aggressive, some are less aggressive, but that is definitely reassuring. They do, unfortunately, anticipate that 42,000 women will die of breast cancer in the United States this year. And so once again, just like with COVID, one death from, is more than we want. And so obviously there are lots of research studies constantly looking for ways to improve outcome with breast cancer. And we've come a long way, but there's still a long way to go. But let's put that in perspective. This, as I told you, breast cancer is the most common cancer in women in the United States, and we're at 42,000 women that will die of that. How many people, period, did we say have died of COVID in 7 months? It was at 223,000. So to put that in perspective, at this point, we've had almost as many COVID deaths as we will actually diagnose women throughout the country with breast cancer. So deaths, so that many people, so way more people are dying right now of COVID than will die of breast cancer, which is the number one cancer in women in the United States. So just so you can kind of put things in perspective, because like I said, we kind of get dulled on these data. Men get breast cancer. I know that a lot of people don't realize that, and yes, it's not anywhere close as prevalent, whereas 1 in 8 women will get breast cancer. The numbers for men are extremely low, but there are going to be over 2,600 men, so 2,600 men in the United States that will get diagnosed with breast cancer. And unfortunately, 520 men, will die of breast cancer in the United States this year. And a lot of times, because once again, men do not think they're going to get breast cancer, we lose that early detection. And so, yes, of the number of men that get diagnosed, there is a higher death rate with them because they're later to detection because they don't think that they could get breast cancer. There are over 3.5 million breast cancer survivors in the United States. So that is a big, big blessing. The numbers it says on average, this is interesting, it says every 2 minutes a woman is diagnosed with breast cancer in the United States. So that's pretty interesting. I'm not quite sure how that happens if we get 276. Oh, invasive. So yeah, so if that's the case, then that just tells you how many people are being diagnosed with COVID. So besides the normal obstacles that women with breast cancer face, in the face of COVID, we now have some newer obstacles because we have a significant amount of people now being unemployed and losing their insurance. So it's one thing to lose your insurance and be healthy otherwise. It's another thing to lose your insurance and have a major medical problem like breast cancer. So there is a significant need for money, for an outpouring of support to our breast cancer clients. And there are organizations out there where you can donate, and this is a time when not only donation to research, but actually donation to those who are actually dealing with breast cancer. There is a significant amount of request to many of the organizations that do support breast cancer patients for both financial assistance and something as basic as food. And so they need food, they need medical supplies, they need transportation to get to their appointments. If they don't, there are people, unfortunately, whose cars are being repossessed because they can't make their payments or who can't afford the gas to put in the car to get to the doctor's appointment. So if you don't have the money, it's something you could consider is actually volunteering your time and being willing to take someone to the doctor, to their chemotherapy appointment or radiation therapy appointment. So there's a lot of different ways that we can give of ourselves, not just financially, but also with our time and our supplies that we have at our disposal. So remember that these people do need you. We also have a lot of people that will think that because they've lost their insurance that they cannot get a mammogram. That is very much not true. This one of the great things about October being Breast Cancer Awareness Month is that many organizations, and this is not new for COVID, but many organizations have the funds to offer free mammograms to people that cannot afford to get one or do not have insurance. So this is actually the time when you want to get out and you want to get your mammogram. If you can't normally get one, because you should very easily be able to find a facility to get a free mammogram. And Dr. Google is your friend, so if you're watching me, that means that you at least are able to surf the internet. And so all you have to do is type in your town. Like if, for example, if you were here in Orlando, you could type in Orlando free mammograms or where to get a free mammogram in Orlando, and you will see places pop up. If you don't find a place, you can also reach out to your local hospitals or any radiology freestanding facilities that you know of, and I can guarantee you that they are either doing free mammograms and or they can refer you to where you can get them. So please do not think that you can, even if you've lost your insurance, that you cannot get a mammogram. Please get out. Please get a mammogram. So who should get mammograms? The recommendation Is at age 40 that you start the getting mammograms, and I know the data changes depending on what year it is, from every year to every 2 years, between 40 and 50. Please be aware, breast cancer increases as you get older. It does not decrease. So it is not like I made it through my 40s, I can stop getting mammograms. Just the opposite. And I recommend that you get a mammogram every single year after age 40. Remember, we're looking at statistics, and just like, it's people think, well, they can statistically say, 80% of people that get COVID are going to have no symptoms or mild symptoms. But if you're that 20% that doesn't, then that changes everything. So the same thing, you don't know with breast cancer that you're not going to be one of the 1 in 8. So 7 in 8 women don't get breast cancer. You may be that 1 in 8. So you want to get in. You don't want to find out that you skipped that year and that's when you got the breast cancer. And if you don't want the what ifs. What if I had gone in and got a mammogram last year and it was caught earlier? Maybe I wouldn't have to be doing X, Y, and Z. So I tell people, early detection, early treatment, early cure. My recommendations for mammogram testing are to get one between age 35 and 36 as a baseline. And then another one if you've gotten one at 35, at age 37 to 38, and then starting at age 40 every single year. And I recommend that you get into either your primary care doctor or your gynecologist, and that you get an exam every single year, and that you also examine your breast every single month. So either right after a period or pick a day. A lot of people pick their birthday, so the 18th is mine. So every day on the 18th, every month on the 18th, examine. That's a little bit hard to remember, but maybe the first of the month or anything, just pick a day and examine them. And people say, well, they say that, it doesn't work, that self-breast exams don't detect anything and that they may not be helpful. Once again, if you detect your own breast cancer, then you're ahead of the game. So 99% of people may not detect one. It just takes one person being able to find that cancer to make it worthwhile to me. So I recommend you examine, you get used to normal. If you get used to normal, you'll know when there's something different. If you never examine your breast and you suddenly examine, then everything's going to feel lumpy, bumpy, and it's going to get concerning. The other thing, you can make it more fun. You can have your partner examine for you, and then it can be a positive experience, and it doesn't have to be something that's boring and humdrum. But do get into a habit of doing it, like I said, at least once a month. You can do more than that, but at least once a month. And believe it or not, when tasked, partners actually are very concerned about their female counterparts' health and wellness, and they actually take it very seriously. And then men, don't forget, once again, that if you do have a lesion, or your breast seems to be getting larger on one side, or it's hurting or it's not hurting, but there's a mass, do not ignore it, because yes, men can get breast cancer as well. As far as whether breast cancer hurts or doesn't hurt, normally most breast cancers don't hurt. So it's the tender lumps and bumps that you can ignore. It's the hard lumps and bumps that don't go away, getting bigger, not moving, that are concerning. Anything that comes and goes, you don't have to worry about. Breast cancer does not come and go. And the reason why we tell you not to examine your breast before your menstrual cycle is because it's normal to have more what we call cystic changes, more lumps and bumps. And so if you examine then, you might find something that if you examined a week later might be gone. And we don't want you to get concerned about something that's not of importance. So ideally examine afterwards. But if you examine before, or if you find a lump, period, and it's not going away, I don't care if it hurts or doesn't hurt, anything that doesn't go away, you need to get it checked out. And so definitely get in and get it examined. The last thing I will tell you for this week, and we can, like I said, delve in a little bit more about breast cancer next week as well. But the other thing is that breast cancer, two other things I'm going to tell you about breast cancer that I hear all the time from my clients. It's more common in Caucasian women, but in minority women that get breast cancer, it's actually occurs at a younger age and more aggressively. So if you are of a black or brown coloring, you should actually definitely be getting that mammogram before the age of 40. And you still want to examine and you still want to pay good attention to your breast. And then obviously, regardless of what race you are, if you have a family history, that puts you at a higher risk. And if you do have a family member that has breast cancer, usually the recommendation is that you, if they were young when they got diagnosed, that person, that if you're in that family, you would get your mammogram 5 years in front of that. So if you had a loved one that got breast cancer at age 39, you would start your mammograms at age 34. And when I say loved one, it's somebody in your immediate family. So we're talking mom, aunt, sister, or maternal or paternal grandmother. And when I say maternal, obviously mom's side or dad's side, but not like second cousin, three removed. So we all have breast cancer. If you go far enough out in your family, you're going to find cancer of one way, shape, or form. So it's not just cancer, period, but just kind of in what we call the immediate family. That's when you pay attention to your testing. But otherwise, like I said, at least one, if not two, between 35 and 40, and then at 40 every single year. The other thing, just to dispel a myth, most people do not get diagnosed with breast cancer and drop dead. So I get many people that say, I'm not going to do anything about it, so I don't want to get a mammogram because I'm not going to treat it. Hindsight is 2020. And so, I can tell you, I have yet to have someone be diagnosed with breast cancer and just say, I'm going to let it run its course and I'm going to just die from that. And so we are human beings and we actually do like to live. 99% of the time. We may not like our world all the time, but we have an innate desire to live and to be healthy. So most women, when they are diagnosed with breast cancer, we are doers. We actually do take charge and we do something about it. Now, what you choose to do about it, that will be up to you. But it's very easy to say what you're not going to do when you're not faced with that situation. So the key thing is if you're not going to do chemo and you're not going to do radiation, you're the one that really needs to get your behind in and get your mammogram. Because if we catch it when it's really, really early, then you won't have to do the chemo. You won't have to do the radiation. And so because things will be caught in an early stage where they could be treated very simply. So it's the people that dig their head into the sand and don't get the early detection and get it treated early that are more likely to get the chemo and the radiation. So don't, I always mess up the saying, but just be aware of it and realize that you're actually doing yourself a disservice and you're actually creating the situation that you think you're trying to avoid if you do not get testing early. So that's my recommendation. And a couple of updates for the office, and then we'll let you go. So our office, as you know, fully open. We've been fully open and running and exciting. We have 2 new staff members. We have Karina, who is our new medical assistant, and she comes with years of experience as a medical assistant, and she has been just a blessing, wonderful smile. And so far, so good. She's been with us a couple of weeks, and bad news travels fast, and I've heard none. And then we also have Chardonnay. So we have a margarita and a Chardonnay, so we're opening up a little liquor store here. But Chardonnay is our new esthetician, and once again, lovely, smiling, bubbling, and knows her stuff, does fabulous facials, and they are helping us to make the office run way more smoothly, because we did obviously with COVID and everything have lots of lumps and bumps, and we were short staffed and all sorts of things. So I appreciate everybody's patience with us, and I think that you, God willing, will find that the office is running much more smoothly, and we would love for you to come in and check us out. Another thing, just so you know, we do our monthly specials, and this month is October, which we are going along with the whole Halloween theme, and we do the vampire procedures, which is the platelet-rich plasma. We utilize it in the hair, we use it on the face. It's called a vampire facial. We do a vampire facelift, which is your liquid facelift. We can also use it in the tatas to give a breast lift, and it's very good as an O shot. And for our guys, we also do a P shot for either vaginal rejuvenation or to help with ED. So all of those, all of our vampire procedures are on sale, 10% off because of October being Halloween, and so the whole vampire thing. So if you're interested in any of that, check out our website, Your Body in Balance Claremont, and the information on all the different procedures are there, or give the office a call, 352-243-6686. Also, remember to follow me, like me, or whatever on Facebook, and if you check me out on YouTube at my YouTube station, Dr. Shelley Knows, then remember to subscribe. As always, have a wonderful weekend. Stay healthy and stay safe. And think pink and get your mammogram. Take care, guys.